Welcome back. In this chapter 15, we zoom out and take an integrative view of counseling and psychotherapy. Over the course, we have seen a few ideas. In next few lecture sessions, a range of theories. Some emphasizes that emotions and lived experience, others emphasize cognition, behavior, relationship, and meanings. Now, in this chapter, we will learn how to integrate these different theories, going beyond the idea that there is one best approach, and instead developing a thoughtful, ethical, and flexible way to draw from multiple perspectives, grounded in theory, grounded by evidence, and shaped by client needs. As you listen through this lecture, I want you to keep in mind this question. If I had to describe my approach in few minutes, what would I say? What would I actually do in session? By the end of this lecture, you should be able to explain what psychotherapy integration is and why it's increasingly popular. We'll also identify the advantage of integration and name some good real challenges that come with building your own integrative approach. We'll also address how multicultural issues can be integrated into practice and how spiritual and religious values can be integrated ethically and effectively when they are relevant to the client. As we advance in these slides, I want you to reflect. When you imagine your future practice, do you see yourself as one theory or more flexible? What excites you about flexibility and what worries you about being flexible or being integrated approacher? We'll also talk about how to draw techniques from multiple theories in a way that it's coherent, not random. Then we'll look at what research generally suggests about psychotherapy effectiveness. We'll end with feedback-informed treatment, how ongoing client feedback can improve the outcomes of therapy session. Psychotherapy is diverse. Some approach focus on experiencing feelings. Others highlights cognitive patterns. Others emphasize behavior and action, and still others concentrate on meaning, identity, and relationship, social networking, so on. Historically, clinicians argue over which approach was best. Integration represents a shift. Instead of fighting theory wars, clinicians ask, what help what helps this client in this context with this counselor? Integration is not a trend for the sake of novelty. It's a response to reality. Clients are complex, problems are overlap, and no single model fits every person. We know that from experience. Individuals, those who come to therapy, bring different historical background, different cultural, ethnical background, socioeconomic status that make our job as therapists challenging. But integration has some advantage and also a few risks. When people pull techniques from wherever they find useful without a rationale, it can become confusing and ineffective. This chapter also highlights few risk that comes with syncretism, which is basically grabbing whatever seems to work without a sound foundation. Now, integration works best when it is intentional, coherent, and guided by clear evidence and goals. That's what we're going to do in this chapter. We will learn about different types of integration, right? We also learn about how to avoid syncretism and understand why it is important to avoid those approaches. So if you think of syncretism, psychotherapy integration means looking across approaches to learn from other perspectives and enhance the effectiveness of psychotherapy. On the other hand, syncretism is using techniques randomly without knowing why or when they work. There are, unfortunately, some practitioners, they have subjective preference over one technique, and bias toward the others. If you ask them, they typically answer, I love this technique. But syncretism is you chose those techniques without looking at the evidence, without looking at the impact that can make on your client. Think of this client. A client shares grief. If I respond with a mindfulness exercise, a cognitive reframe, a gestalt chair dialogue, and a homework assignment with all in one session without a plan, that's not integration. That's a noise. Integration would sound more like today, our goal is helping you tolerate the emotion without being overwhelmed. So we'll use one strategy to ground and one strategy to progress meaning. So that sounds like you have a rationale behind choosing certain technique rather than just haphazardly choosing different tools. Most psychotherapists prefer some forms of integration, and it's expected to keep growing. The goal is to enhance efficiency and applicability of psychotherapy, meaning make therapy more useful to more people in more contexts. Think of integration like building a well designed toolbox, not a junk drawer. This reminds me of my workshop. When you are disorganized, when you don't have intentional planning for your tools, it fails and it does not serve any purpose. And recently, I organized them into my small toolbox that is more for homework. When I have a minor fixing to do, I have a specific tool set that is planned for those purposes. The same way, when you become a clinician, when you become a therapist, you will learn, when some people bring their questions about cognition, question about emotion, question about behavior, you may develop a set of tools that work for those domains, right? Let me see if I can write on the screen. So if there is a behavioral problems, there's a cognitive problems, emotional problems, depending on the types of problem they present, you might have a set of tools that can effectively respond to those situations. And how do you integrate these different techniques and tools and theories? Now we'll look into a few integrations. The first one here is technical integration. It is about selecting the best techniques for the person and problem without necessarily adopting the full theory or subscribing to a theory behind those techniques. One good example would be technical eclecticism. Now, a lot of therapists use this term eclectic approach where they collect or use technique from different theories. It's also another term is multimodal therapy. It is often discussed in this category. If a client has panic symptoms, you might use exposure-based strategy because for panic symptoms, you can help client to gradually desensitize those signs and cues of panic disorder and also introduce some overall relaxation and other technique. Now this is purposeful. Is it the best? I will let you decide. Just using the technique without a full understanding of the theory might have some advantage but also more limitation. Now the better version would be assimilative integration, meaning you will ground yourself in one primary approach or theory, but you select different tools from different techniques. For example, mindfulness-based cognitive therapy. As it sounds, the approach is based on cognitive theory. At the same time, you also use mindfulness approach, which comes from Buddhism, which comes from Eastern practice, into cognitive therapy. Now, this mindfulness-based cognitive therapy respond well for people with depression, people with other anxiety-related conditions. So you have a home base, which is cognitive theory. You also travel wisely around other domain like mindfulness, behavioral activation, and so on. I think I might have missed one. Oh, the second one I have missed here is theoretical orientation. This one is a little deeper than the first one we talked, technical integration. Theoretical integration is instead of borrowing techniques, it tries to integrate underlying theories, more than one, into one synthesis, sometimes richer than one theory alone. For example, here you see acceptance and commitment therapy, dialectical behavior therapy, and emotion focused therapy. If you look into each, dialectical behavior therapy has behavioral theory in it, cognitive theory in it, mindfulness in it, and also sometime psychoanalysis, right? It's a combination of multiple theories. And ACT, acceptance and commitment therapy, has the philosophy of language. It also take cognitive approach. It also take mindfulness. Emotion focused therapy takes cognitive approach, behavioral approach into it. So multiple theories combine, integrated in this approach, right? And the third one we already talked is assimilative, where you integrate other techniques, but you have a home base, which is one particular theory. The last one is common factor approach that focus on elements shared across theories, not necessarily theory itself. What are the elements within those theory sound better? For example, therapeutic alliance, building empathy, instilling hope, collaboration with client, and also therapist credibility. Those are found to be most effective ingredients in psychotherapy. And you try to emphasize these common factors and use them as a guidelines for better outcome and integrate them in your practice. It has strong empirical support. Research shows these are the ingredients in different theories that work best. So if even you love different techniques, you have to remember the foundation, right? What makes therapy work regardless of theoretical orientation? It's a relationship, it's collaboration, and it's client's engagement. Now, here's the tension. Integration is appealing, but it's also challenging. Developing an integrative approach requires, yeah, so it requires understanding theories well enough to borrow responsibly. Choose interventions based on a plan, not an anxiety, matching interventions to clients' goals, culture, readiness, and context, and stay clear about your role in the process. What's the biggest risk as a developing integrative counselor? Being too rigid with one model or being too scattered and trying everything? So, this slide, as you see, lists many possible therapeutic goals across approaches. Sometimes you might have these goals: restructuring personality, uncovering unconscious patterns, creating social interest, finding meaning, curing an emotional disturbance, examining old decisions and making new ones, or developing trust in oneself. Integration starts by recognizing that goals vary. And the goals you choose shape the methods you choose. So if you know your client's needs, you will change your approach. So the goal should inform what kind of intervention should be used. If the goal is managing intense anxiety this week, we might prioritize coping skills and behavior change. If the goal is understanding why I keep repeating the same relationship pattern, we might prioritize insight and emotional processing. In addition, there's more. If some client has their goal as self-actualization, reducing maladaptive behaviors like a self-medication, avoidance could be maladaptive behaviors. Grounding in the present moment, constantly worried about or constantly dwelling in rumination. So you want to ground them in the present. Managing intense emotions like in panic attack, in PTSD, right? Gaining control of one's life. In example, you could think of sleep disorder or eating disorder, and reauthoring the story of one's life, dealing with personality disorders, dealing with other challenges. Notice how broad this is because clients are broad. Integration means you're now focused into a single definition of success, not that you're focused on single definition of success. Again, let me tell you, integration means you're not focusing into a single definition of success. You collaborate with the client to define success, and also sometimes it's important you define what help looks like and you build a coherent plan. Think about this. Which goals do you naturally gravitate toward as a counselor? Is it insight, action, emotional processing, meaning, or identity, or combination of more than these? So even in an integrative approach, The therapy client relationship matters, as you see in these highlights, right? And the client experience matters. As a counselor, our job is to make sure that our integration does not bring everything at once. It means being intentional about how directive you are, how structured sessions are, how you share responsibilities, and how you evaluate progress. Think of this question: what does this client need from me right now? Space, structure, challenge, skill, or meaning making? Now we turn to techniques and evaluation. This is where integration becomes either powerful or confusing. The key message here is techniques are tools. They should serve the client's goals, not the counselor's performance. As a new counselor, we saw there are anxiety, there are challenges. However, as you advance, as you become seasoned, your job is not to perform well, rather, understand clients' goals and serve toward those goals. And in this journey, there are many counselors who get stuck in this integrative approach. How do I borrow techniques without losing coherence? Here's some structure you can use in your own practice. Start with a clear case formulation, your best working understanding. Now, this is another practice you do in other classes, like I teach abnormal psych. You learn to develop case conceptualization. You tell a story from clinical perspective. Identify one or two priorities for this phase of treatment. Client comes with full of problems. They share everything at once without any plan. As a clinicians, you learn to prioritize what is the most pressing concerns for the client in that given time. Select interventions that match those priorities. Monitor impact and adjust based on client response. At the end of the session, you may use gazing, and we'll talk about that feedback informed treatment, right? You can ask client using a scale to tell them how well it went, what can be done to improve. If client is stuck in self-criticism and avoidance, your priority should be reduce avoidance and build self-compassion. What can you use? Well, behavioral activation, doing something, cognitive diffusion or restructuring, thinking in different ways, compassion focused imagery or chair work or chair dialogue. Talk about feelings. You don't do all of these at once. You sequence it as needed, right? Now, before we get there, there's another piece of information I'd like to share here is when you evaluate, your outcome evaluation is not just a research concern, it's also a clinical responsibility. We want to know, is this helping? Are we moving toward the client's goal? If not, what needs to be changed? So evaluation can be informal through regular check-ins or formal through brief measures. Either way, the counselor's job is to stay responsive rather than assuming progress. And again, as a new counselor, you may have a sense that, oh, the session went very well. If you ask the client, you might have a very different opinion. So it's very important that you gaze formally or informally whether the session is working toward client's progress or I would say recovery in a way that they define, right? This slide emphasizes that theories can and should incorporate a multicultural dimension. Practitioners, oh yeah, practitioners tailor theory and practices to the unique needs of the client. Remain aware of both counselor and client worldviews and use culturally appropriate interventions. If you have a certain background, and we talked about this in previous sessions, culture is ongoing process. You might have an assumption about certain culture. Rather than assuming, you inquire from the clients so you can tailor the client's need. Integration isn't only across the theories, it also across culture, context, and lived experience. For example, a client who's reluctant to disclose might be framed as resistance in one worldview, but as respect, caution, or cultural humility in another. I can give you example, from my experience being as a Buddhist monk, making eye contact, talking to your seniors or talking to somebody in authority, we take little time to warm up. That does not mean the person was resistance, but it's more like a sign of respect. Same thing with other nonverbal cues. So we want to be mindful of this ethical and effective integration using this cultural meaning and cultural interpretation of certain cues. And we adjust our approach based on those understanding. Here we talk about spiritual and religious matters that can be therapeutically relevant and ethically appropriate to discuss in counseling. It also frames spiritually informed therapy as a form of multicultural therapy and highlights the client in crisis may draw comfort, support, and strength from spiritual sources. When you think of clients, they may have certain belief system, certain religious practice, it inform why they have developed certain worldview, why they have certain view of themselves and others. So the client leads in this practice, right? A useful line is, are spiritual or religious beliefs important to you in how you understand what you're going through? If the answer is yes, you can integrate those aspects respectfully. If the answer is no, you may explore more, but you never try to force those ideas into client. Feedback informed treatment is designed to evaluate and improve the quality and effectiveness of counseling services. It monitors clients' change and identifies modifications need to enhance in therapy session. Here you see that outcome rating scale to track progress, the session rating scale to track quality of therapeutic relationship. Why it is important. Sometimes clients stop improving not because they are unmotivated or they are resistant, but because the approach isn't fitting. So we use feedback informed treatment, either outcome rating scale or session rating scale that gives you real-time data to adjust early and even before client is silently disengaged. Like mentioned earlier, you can informally, you can ask them how the session is going on. You can use a scale on a scale of 0 to 10. How helpful was today's session? And what can we do to make next session a little more helpful? That might give you a little sense, what client was, how client receptive was to your treatment plan and treatment approach, and what they expect from your next session. So integration is a movement toward flexibility with coherence. It becomes powerful when you understand theories well enough to borrow responsibly, avoid syncretism by having a rationale rather than haphazardly choosing tools from all over the place. Match interventions to clients' goals, culture, and context. Depending on, like we mentioned, what are the goals, you choose the tools that fits well, supports well. Attention Pay attention to common factors like alliance and collaboration. Integrate cultural, multicultural, and spiritual dimensions when it is appropriate, and use feedback to adjust approach over time. And this will help us to be an effective, integrated counselor, therapist, and psychologist.